you start feeling completely differently. You have the problem in sleeping and you face the problem like insomnia. Hey friends, welcome to the channel Health Tricks and Tips in English, the best pregnancy centric channel. Third trimester of pregnancy, it is your last trimester and it is full of complications as well. Third trimester normally starts with the 28th week of pregnancy, that is from the starting of 7th month of the pregnancy. So let's pick up the problems one by one. The number one problem you could face is the preeclampsia. Now, after the 20th week of the pregnancy, you can feel this condition. It's a very big condition, very big problem, wherein your blood pressure increases very high. You can face the problem of swelling in your body as well. You can have fever and headache as well. You may gain excess weight and the protein in the urine increases very high. You can also face the problem of blurry vision and you can have pain in your abdomen region. Now this problem is not at all very common problem. It happens to quite few of the pregnant women, but if it is happening to you or you're seeing the symptoms, you should immediately need medical attention. Number second thing is depression, and it is all because of your hormonal changes. You start feeling completely differently. You have the problem in sleeping and you face the problem like insomnia. Sometimes you may face the problem like your baby is not growing properly in the womb, and this is also one of the reason why you are in depression. This makes you not sleep well or to not eat well, and which results in depression, fatigue, and weakness. So, if you are feeling any sort of these changes, you need to have a proper advice from your doctor. Relax your mind, relax your body, do some yoga, some meditation. This will definitely help you out. The next complication is the placental abruption. It happens in some rare cases that the placenta and the uterus split just before the start of the labor, and this is known as placental abruption. It is a very dangerous thing and it could lead to the preterm labor or the miscarriage. With the placental abruption, you could also have vaginal bleeding, extreme pain in your abdomen, and heavy contraction. This is again, as I have said, it's a very rare case and it usually happens when you are having problems like diabetes, hypertension, you are still consuming alcohol or smoking, or in case you are having twin pregnancy. Because twin pregnancy sometimes leads to excessive amniotic fluid, or in any case, if you are having excess amniotic fluid in your amniotic sac, it becomes one of the reasons for the placental abruption. Another problem that you will be facing is the breathing problem, and this problem is basically attached to the uterine expansion. When your baby bumps comes out, it actually pressurizes your lungs as well, and so your lungs find very less space to expand properly, and due to which you find difficult in breathing. This normally happens whenever you are sleeping. So while sleeping, you need to take extra care of yourself. Always sleep by the sides, or left hand side or the right hand side, and also take support of the pillow or the pregnancy pillows to keep you in a proper posture. The next problem is the gestational diabetes. And this is a very common problem, and due to which the blood sugar level in the body increases a lot. Now, as we know that the blood is the only thing that goes to the baby and provide all the nutrients, so the quality of blood is impacted. So there is a bigger chance that the gestational diabetes impacts the growth of the baby as well. So to avoid this condition, you have to restrict the quantity of sugar you are taking, exercise well, walk well, and drink at least 8 to 10 glassful of water per day. So you need to be very proactive of all these changes that is happening to you. In case you find any of the things that I've told about, you need to be in immediate contact with your doctor. Let's catch up in another video on pregnancy. Till then, stay happy, stay healthy.